will be new books for May 2014, medicine books, because I've been recently thinking about medical school as something to go into and curious about the medical world. So I bought a few books on medicine. Most of these books are from the Better World Books order that I ordered, but some of the books are from just buying them in used bookstores. So here's the one I'm actually reading right now, about halfway through. The Making of a Surgeon by William Nolan. He's got a few books, so he is a famous doctor who writes books about medicine. About not about medicine as in textbook medicine, but about being a surgeon. And this is his book about going through not medical school, but going through residency and internship, which means that you work in the hospital and you do, as an intern, you're kind of the grunt worker. You do the blood work and you do the random, they call it scut work, which means you have the resident who's over you gives you a list of stuff to do, and then you have to go and do it. So they'll say, this patient, Mr. Brown, he needs blood work, he needs this check, he needs this check, and so the intern will have to go and do it. He's a surgeon, though, so he has a specialty. So he does do GP kind of stuff in the hospital, but he also is an intern, and then right now I'm into where he's an assistant resident, which is like the first year residency. So you do 2 years of medical school, you do 2 years of training, and part of that is being an intern. And then you do 2 years of residency. So then right now he's in his first year of residency, halfway through the book. It's a good book so far. It's not technical, and he just talks about stuff that's happened and the conditions of medicine at the time and the conditions for surgeons. He's working at a hospital that is not the most prestigious. It's kind of rough, and they don't have all the supplies all the time, and so interesting point of view. It's also written, like this was written, I think, in the 60s. So the language is a little bit old. This is 68. So, for example, a black patient comes in, he calls them a Negro. So that dates the book a bit. I don't know how closely the medical world works today, but I still think it's interesting to kind of see the kind of cases he gets in, because the kind of cases he gets in are the same cases that are going on today. People come in with, a gallbladder infection, they have to get it removed or whatnot. There's different wards for male and female, which I don't know if that's still true today, but like different surgical wards. So anyways, it's a good book so far. Here's another one, Complications. This is by Gawande, A Surgeon's Notes on an Imperfect Science. So this is, again, more on surgery and hopefully more technical. I kind of wanted to get more technical, but because I'm interested in the kinds of, I guess it's called complications, so hopefully it talks about complications, but I do want it to get a little more technical because I'm curious the kinds of thinking involved in being a doctor. Here's a book by a nurse, Intensive Care, The Story of a Nurse? Yeah, The Story of a Nurse by Heron. I assume that's a pen name, because who would name their kid Echo? That seems like you'd be setting your kid up to be ridiculed in school. But anyways, a book by a nurse, another point of view on the hospital field. I know the Nolan book, and also another book I'm going to get to that I've read, actually. It mentions that nurses are very important to have a good relationship with nurses, because nurses can really screw you as a doctor. They can really make your life hard, and nurses do all the underlying things. So if you have to befriend every nurse, especially the nurses that are hard workers and that will do lots of things for you, that will help you out a lot. So nurses are very important. So that's another point of view. And it's supposed to be popular. It's supposed to be a well-known book, I guess, for medical. Here's a very technical book. This is just a MERCK manual, medical information. This is just a dictionary kind of all the medicine stuff. I've been doing a little bit of this, which is probably a little bit strange, but well, another reason I got interested in medicine is because of House MD, the TV show. Because I hate, by the way, all the social immaturity that they gave the character House. I think that's awful. Like, I think that really says something I think, gross about society, that when they create a very good and a very different kind of thinker about medical problems that make connections between strange things and are very good at what they do, they have to stab him. They have to inflict on him a mortal wound to make him out to be not a great and ideal person, but instead a person who's got great things in one part of himself, but horrible things in another. They have to balance out his character, otherwise all the viewers would just, because of their vanity, and because of envy, because they get envious of a great character, they have to give him a mortal wound, a flaw, to make him a social child. Like, the kind of stuff he does in the TV show is ridiculous. Just idiocy and just like dorm room, just crap they had to cut him with. Like, I just think that's awful. It's a terrible thing about that they had to do that, because people would be envious of his rationality and knowledge and ability to make connections. So the reason why I'm going through all this, throughout the TV show House, I've been looking up stuff in that book just to kind of see what it is, like sepsis or the kinds of procedures they do, like an EKG or a lumbar puncture and all that kind of stuff. Just curious what, like, it's a TV show, and obviously there's some accuracy, but there's also probably some inaccuracy. So I'm just looking up some of the stuff in the book too to see what it is, and kind of get myself familiar with the kinds of terms that they use. So, okay, here's another one, Intern Blues. I've read this one all the way through in 2 days. I just kind of spent all day reading it for 2 days. Intern Blues by Robert Marion. He is the editor, and he has a few chapters in it, but the book is about 3 interns working in hospitals in the States, and they have diary entries, fairly long diary entries, like maybe 10 pages each, and then the next person writes for 10 pages, the next person writes for 10 pages, and then the editor writes every now and then. And it's about their times in internship, and the book also kind of, I get the sense that the book is also trying to say that these are the working conditions for interns and they need to change. The editor, in some of his couple chapters, which are just kind of commentary chapters on what the interns are doing and all that, he also kind of says that he's also kind of advocating for improvement of working conditions for interns, because sometimes interns will work 24-hour shifts, or they'll be on 24 hours. They'll go home and sleep for 5 hours or 4 hours, and they have to come back in, and then they're what's called on their post call or something like that. And what they can do is, especially over nights, there's a little room. This is really strange. In hospitals, there are little rooms with beds for interns and residents to sleep on the job. Does that exist in anything else? Do we have people in business, in big financial companies or factories or whatever? They have rooms with beds in them for their workers to sleep because they're working 24-hour shifts? No. And I think there's even laws against working that long. Isn't there a maximum work per days? There certainly is a TA, by the way. And yet, especially in Canada here, where medicine is socialized, we're so concerned about the conditions of healthcare, and yet many of the patients that are seen in hospitals are seen by interns who are getting very little sleep. It even talks about at one point one of the interns falls asleep while collecting blood from somebody. It just sleeps right there. I think it's so contradictory to believe that we're really concerned about healthcare, and yet we're going to have people working on patients who are up for 24 hours at a time and are supposed to make medical decisions. Really? And so the only thing I can think, I've heard from some people that the reason why they do that is because they want interns to see a lot of patients in a small amount of time. They want to concentrate their experience as much as possible, so they give them 24-hour shifts. They work 5 days a week or whatever. 6 days. Actually, they work 6 days a week. They had 1 day off every week. And so I've heard that. The reason why they do that to them is because they want them to get as much experience as possible in a small amount of time, and to see as many patients, to see as many illnesses and afflictions as possible. On the other hand, I think the actual reason for all of this is what I call generational trauma. The old doctors had to do this. They had to go through 24-hour shifts and sleepless nights and eating pizza because they don't have much time to eat and being on call all the time. And so the younger generation can do it too. And they can endure that pain and suffering. I think that's what's really been going on. It's just that kind of mentality. Especially doctors and doctors' unions, of course, will be a group, a collective, and they're going to think and want to have an exclusive group, right? Exclusivity. So they're going to create a gauntlet. And, of course, the doctors who are in the union are the doctors who survived the gauntlet. And so they're not at all concerned about putting other doctors through the gauntlet, even if it jeopardizes patient care, which they don't care about. Of course, they have insurance. So, and of course, it's not on their backs. It's the interns who get nailed. But although the patients that come through are actually attached to a resident, and there's what's called an attending, and the attending is the doctor who's a full-time, licensed through residency doctor. The attending has jurisdiction over all the patients, and then a residency has a responsibility for some of them. And then interns work with a smaller amount than that and do the grunt work. The residents, what they do is they look at all the grunt work that the interns have done and make decisions. And then anything that's really strangely complicated, they'll ask the attending. And often the attendings are not actually attending. They're not there. They get called in once in a while. They probably have regular hours because they'll probably see patients, but certainly overnight and certainly in the evening, attendings are not there, and they call them in. But anyways, Intern Blues was a good book. It's quick to read. It's easy to read, and it's interesting. It's not that old either. I think it's published in the 2000s. Let me see. 2001. This is a second edition. There's a bit more content in this one. It was first published in 89, but this edition was published in 2001, and there was some added content to the back of it. Anyways, it was a good book. And there's two more in medicine. There's kind of a history. Mavericks, Miracles, and Medicine. The pioneers who risked their lives to bring medicine into the modern age. This book, I actually got the recommendation from Mr. Cropper, who you should look up on YouTube. He's got tons of stuff. If you like the kind of book videos that I do, then you'll love Mr. Cropper's channel, because that's all he does and did. He hasn't been on for a few years. But he read this book, and what I remember him talking about was, one thing they talk about is doctors washing their hands, and it used to not be a practice. Doctors wouldn't wash their hands. They had a very strong arrogance in the past, and by past I mean at least 100 years ago, 200 years ago. They would do autopsies on dead people, cadavers, and then go to the maternity ward and deliver babies and not wash their hands. And this would kill mothers and kill babies. And eventually, I don't know who it was, someone eventually started telling people to wash their hands, and they were heavily resistant to it. They thought that, oh, how could you say this about us? And how could you say that we're actually causing illness? And I'm not sure if at this time the germ theory was known or accepted. Maybe that was the issue. This was probably at the time when they still had those. Your health was based on 4 conditions, 4 quantities that you had to balance. I'm not sure if I'm going to remember them all. There was blood, phlegm, black bile, and yellow bile. I think that might be it. That's how they used to practice medicine, I think, in the medieval era. And any illness you had, it was because you had one of those out of balance. You're supposed to have a balance of all 4. So that's why, for example, in certain afflictions, I think with heat, they thought that was a blood problem, and so they bled you a bit. They let you bleed. They would cut you and let you bleed, or give you leeches to suck some of your blood to cure illness, because they thought you had too much blood. That was a too much blood illness, whatever you had, some kind of heat issue. But anyways, so this should be a good book on the history of medicine, especially the people in medicine at the time, because they're still human beings, as Nolan in his book talks about. Surgeons and doctors are still human beings. They still make mistakes. They still make bad judgment calls. They still get self-interested in certain things, or certain things cloud their judgment. Certain people also engage in fraud because they're human, and that happens. There's small cases of that in every area. Politicians more so. But that should be good on the history. And here's one more on medicine. Med School Confidential by Miller and Bissell, both MDs, or at least the one's MD. A complete guide to the medical school experience by students for students. I thought that would be fantastic. I haven't looked in this yet, but it looks like it's actually a guide to help you get into medical school. I was actually told by a doctor when I was at the doctor's not too long ago that the greatest difficulty about, I'm not sure what it was, about being in medicine is getting into medical school is the greatest difficulty. And so this should be fantastic. I know I have to do an MCAT, and I hate getting reference letters, but I have to do that too. And interview, apparently at the PAT, you have to have an interview. So I'll have a PhD though. I don't know whether that will make a difference. I know medical school people, of course, are taught by professors, all with PhDs, hopefully. Or, well, I guess not. I shouldn't say hopefully. There's probably going to be people in there, too, that are doctors who are more attached to the actual field versus professors who tend not to be. But I wonder whether the academics then will like people that have PhDs in other areas, because you're then a kind of a trained academic, and you know what that's like, and you know what research is like. And also, I think this is kind of a rumor, but I'd heard that medical schools don't really necessarily have a preference for, or even like, people who go through the regular pre-med and they go to university and take biology, and they take health science courses and whatever, and they're all straight up into medical. They actually are looking for people from different areas. They're looking for people who did a degree in history, looking for people who did a degree in maybe art or maybe economics. They want people from a variety of backgrounds who, of course, have all the prerequisites. You have to have the prerequisites like biochemistry and things like that, which luckily I have because my undergraduate was chemistry. My first 2 years were biochem, actually, and then I switched to straight chem. I luckily have the prerequisites. But I think they're also interested in people who come from different backgrounds, because I think I think they're right in that it brings more life into the field, because people are not hard medical science people who that's all they see and all they think about all day. There's also people who are experts and very knowledgeable about literature and about ethics, and that will bring new perspectives on medicine, and they hope that new perspectives bring new ideas. So anyways, that's my new books on medicine. So now we'll do education.